Okay, great. Oh, good morning, everybody. It's Heather Chubb with the Chubb Law Firm, an aging care attorney. And my guest this morning is Sharyl Eichhorn, Director of Partners in Care Hospice. And she's going to make us smart about hospice. I know that it is mysterious to a lot of people and probably a really underused resource because it's understood. So Sharyl, welcome.
Thank
So
you.
happy to have you here.
Thank you so much. I appreciate any time that I can talk about hospice care because it is close to my heart and I think it is underutilized. So whatever information I can put out there, I would love it.
Great. So let's just kind of start with what is hospice and then how do you qualify for it?
So hospice care is for anybody who has a long-term chronic illness that they're no longer able to get treatment that could be life-sustaining. So, for example, we have cancer patients who have maybe been on chemotherapies. We have heart patients that there's no longer interventions that they could have that will extend their life. So oftentimes a physician will say, you may want to look at hospice care at this time. So really it's comfort care, and it's comfort care in their homes, whether that's a personal, house in their home with their family, or if they live in a facility. It could be a skilled nursing facility that we go into. It could be a board and care facility, assisted living. So hospice care can be provided wherever that person lives. And it's a team of people. It's a nurse, it's a home health aide. There's a social worker and a chaplain available that see you about twice a week in your home to take care of manage any symptoms you may have. It might be pain, shortness of breath, whatever it may be. We don't stay in the home for caregiving, but we provide intermittent care in the home to keep people comfortable in that time. To qualify for it, your doctor would need to say that if we allowed the illness to take its normal course without intervention, you may have 6 months or less of life to live. However, I always say I've had patients on hospice for 2 years. I've graduated people because we don't really have a crystal ball. We don't know. But we're just looking statistically with this disease, it could be 6 months or less. So that's really what qualifies. So the doctor gives an order and says, yes, let's start hospice care. And that's how we get started with it.
Great. And I did want to make super clear, because this is one of those myths. Hospice care is not the same thing as that hands-on care with the activities of daily living. So if somebody's at home and needs some help in that direction, they still need to figure out how to have that, correct?
That's correct, right. And oftentimes you're right. We go into a home and people think we're going to stay there and spend many, many hours, but it's just a nurse would be in the home for about an hour, assessing medications, looking at symptoms, getting orders so that we can change medications if needed. And then we ask that families either provide the care if they're in the private home, or they may have to hire caregiving and have some caregivers come in to help with all the other things, the dressing, the bathing, things like that.
Great. So I think that answered, our part of our next question, like what are the services that are provided? I think that answered it really nicely. But the other big question is, who pays for hospice? How does that get paid for?
So, the beautiful thing with hospice is that Medicare pays 100% for the services. So any of the staff that you would see, the nurse, the social worker, is all paid under Medicare. So those services are paid. We also provide medical equipment. So if dad needs a hospital bed, if he needs a walker, a wheelchair, that's all provided as well, no cost. We provide some of the personal care items. It could be, pads for the bed, pull-ups, things like that is also provided. So Medicare really does step up and pay. They do pay 100% for the services. And most private insurances will pay close to what Medicare is covering. It might be 80%. So private is a little bit different, but for folks who have Medicare, it's completely covered, and Medi-Cal. We do accept Medi-Cal.
Okay. So that's a really great point. We often think of hospice for our elders, but some younger people, unfortunately, may need to use hospice services too. So that's when that private insurance would come
Right.
in, right?
So there may be an out-of-pocket cost to them. Yes.
All right, great. Okay, so let's say we have somebody that's qualified for hospice and we started the services. How long can that go on generally? You talked about 6 months, 2 years. What does that really look like?
In general, we see patients, in my opinion, it's too late in the process because you have this wonderful team that comes in to support. And so say we have someone that comes out of the hospital, they've been going back and forth and they've decided, I don't want to go back to the hospital anymore. It's time. My doctors have said there's nothing more they can do. We start them on care, and depending on where they are in the process of their disease, it may be a week. And we're hoping for more like 3 to 6 months so that we can provide more comfort care. And so they can stay on as long as they still qualify. I have had folks that we think their disease is taking a certain path, and then suddenly, wow, they're doing really, really well, and we graduate them off the program. They can come back into the program at any time, but they do have to still show that there's some decline, that there's still some changes. If they continue over the months to show that they are declining, then we can keep them on. Like I say, I had a woman with lung cancer who was on with us for 2 years, but every time we requalified, which was every 2 to 3 months, we meet with the medical director and we make the decision to keep them on hospice. She continued to have the trajectory that indicated it still could be just 6 months, but she was with us for 2 years on hospice. So.
Okay, great. So you've talked about hospice being primarily just comfort care, but if the person in hospice is taking various medications, will they still continue to take those medications and see their regular doctors while on hospice? How does that work?
With our hospice, we do allow people to continue taking medications as long as they're beneficial. Sometimes the burden of taking, 15 medications at once is just too much. So then we may look at it and give the advice that, well, does dad really need that vitamin D? Does dad really need that multivitamin? Sometimes it's just too much. And sometimes, these medications can actually cause more side effects than they are beneficial. So we'll look at the medications, and if I'm going to go with a heart disease, if they have medications to keep the blood pressure down, that's keeping their heart regular, we want to keep those medications. We want them comfortable and we want to keep them on those. So yes, they can continue their medications, and then we will advise as we go if they're not beneficial anymore. And we may start to decrease the numbers of medications and what they're getting. And then we may add some. If they need something for pain control, we might add a pain medication. And this is all, nothing is forced. It's a collaboration. It's a team. We work as a team with families and the patient to provide the best care and comfort.
Great. So if I have a loved one and I think that, let me explore hospice, how do you start? What's the first step?
The first step would be to go to your care provider and say, I've had mom at home with Alzheimer's. She's really declining. She's not eating much anymore. She's had a couple falls. I'm wondering if she might qualify for hospice care. And the physician might say, well, I need to see mom, so bring mom in. And then you have a consult, and then we would get the order from the physician. We can, I've had families on their own call the agency and ask for an evaluation. So then we can go out, make the evaluation, and then we can step in as well and call the physician and say, you know, this person really qualifies, especially if it's someone who can't get out of the home, so that we can collaborate and get that care. If mom or dad is in the hospital, you'll have care coordination, social work that will help coordinate for hospice care if that's desired. And I always want to say people have a choice of the hospice they use. So always know that, you know, if it's presented to you, that, you know, families can make the decision for which hospice they would like to use.
Great. I'm so glad you brought that up. Choice is so, so important. So we are actually at the end of our time. It just seems like it flies by. I
Yeah,
am
that was great.
so pleased that you joined us today and, you know, illuminated that world of hospice. So,
Well, thank you for having me.
yeah, my pleasure. And to our audience, if you have questions about hospice, on the screen, you can contact Sharyl, and her team will help you out. So, hope everybody has a great day.
Thank you, Heather.